Acute osteomyelitis. It is an infection of the bone and the bone marrow for a duration less than 2 weeks. It is mostly a pediatric disease, that is 99% of acute osteomyelitis occur in children. Etiology and pathogenesis is same as that described in the above videos. Clinical features, it occurs in children, elderly, immunocompromised and IV drug users. Now coming to the symptoms, there can be fever, pain of the limb and pseudo-paralysis can occur. That is, the child will be unable to move the affected limb, like that same situation as that of a paralysis. Then there can be lethargy and there can be history of decreased food intake. Coming to the signs, the patient will be febrile, dehydrated and there can be signs of inflammation, that is rubor, calor, dolor, pallor, etc. And there can be a fluctuant swelling if abscess is present. Coming to the management, investigations are blood investigations that show raised total count, differential count, ESR and CRP. One specific marker for bacterial infection is serum procalcitonin and that also will be elevated. Coming to the imaging, first X-ray. So the first change in X-ray is a soft tissue shadow which is seen around the bone, which is very non-specific and that occurs like after about 1 to 2 days, but it is very non-specific. So hence it is not, X-ray is not the investigation of choice, and X-ray can show a change only after 7 to 10 days, that is a newborn formation, periosteal reaction can be seen. So X-ray is not the investigation of choice. So which is the investigation of choice? MRI. So the first change is marrow edema, which can be seen within 24 hours. And other investigations include bone scan and aspiration. So if on aspiration you get pus, then it's diagnostic of acute osteomyelitis and you can send this pus for culture and sensitivity, and antibiotics can be given based on this result. Coming to the treatment, if the patient presents before 48 hours, there is no abscess formation. And if he comes after 48 hours, there can be abscess formation. So you have to drain it. So before 48 hours, the only treatment is antibiotics. That is given based on the culture and sensitivity report. So IV antibiotics for 2 weeks and that will be followed by oral antibiotics for 4 weeks. So total duration is 6 weeks. And if he presents after 48 hours, abscess is there. So you have to drain the abscess and then antibiotics is given. Complications. So the acute osteomyelitis can turn into chronic osteomyelitis. That's the most common complication. Then there can be septicemia. So infection can reach the blood and it can reach different focus of the body and that can cause infection there. Then there can be septic arthritis, that is infection of the joint. Then it can also cause damage to growth plate. So if the growth plate is damaged, there can be shortening of limb or there can occur an angular deformity.